Improving lives. The future of work, health and disability. Ministerial foreword. A country that works for everyone is a country which helps everybody who lives in it, and this means helping everyone to fulfill their potential. Bringing out the best in people, using their skills and talents, is key to a strong economy. But it is more than this. Good work helps to bring good health. We know that unemployment is generally bad for health. Even though the employment rate for the United Kingdom is at a near historic high of 75%, only about 50% of disabled people are in work. In our manifesto, we pledged to see 1 million more disabled people in work. It is important that we make a change now, not later. Around 1 in 6 people old enough to work have a disability. The way people work is changing. It is more flexible and is becoming suited to more and more people. Technology has helped employers to make work easier for disabled people and people with health conditions who want to work. The reasons disabled people and people with health conditions can find it hard to work are different for everybody, and there are new ideas which could help to make people's lives better. The government cannot achieve the change needed on its own. Lots of people across the country have been involved in making life better for disabled people and people with health conditions, and the government wants to help by making it easier for these people to help create change. Every employer and manager has an important role in creating this change too. They should help get disabled people and those with health conditions into work, and they should help them stay there by supporting them to achieve their best and by making the workplace a happy and healthy one. It is also important that the welfare and employment support system, which supports many people, is joined up with the healthcare that people also use. Health services should help people overcome barriers to work, and we want people in work to be able to get the help they need to stop them from falling out of work. The government is taking action now, and will do much more over the next 10 years. The government has an important role, but everyone has their own part to play, so we can build a society where everyone has the chance to reach their potential. Executive Summary. In Improving Lives, the Work, Health and Disability Green Paper, published in October 2016, we talked about building a society where everyone is positive about disabled people and people with health conditions. The government wants to see 1 million more disabled people and people with health conditions in work over the next 10 years. It is important for us to act now. The number of disabled people has gone up recently and is likely to go up in the future as well. Supporting more disabled people and people with long-term health conditions to get and stay in work, as well as also helping people keep healthy and in work, will help them reach their potential and be more financially independent. Including the talents of disabled people in the workforce can potentially also help employers to be more competitive and productive. We want to work with employers to help them make this happen, and help reduce the costs of ill health that prevent people from working, an estimated cost to the economy of £100 billion a year. We want everyone to have the chance to be independent and to be able to achieve their goals in life. We want employers to see the good things that a diverse workplace, which includes the talents of disabled people and people with health conditions, brings, and with more people in work, the economy will benefit also. This paper sets out what we will do to make the changes over the 10-year period. It explains how we have taken forward what people told us in the consultation. It also provides the government's response to a report called Thriving at Work, the Stevenson-Farmer Review of Mental Health and Employers. It also talks about a report called Good Work, the Taylor Review of Modern Work Practices, and also some of Dame Carol Black's suggestions in her independent review of the impact on employment outcomes of drug or alcohol addiction and obesity. It mainly covers the next 2 to 3 years. Some changes we are making now, as well as working with other people and testing what ideas will work best. This will help us know what other changes to make over the 10-year period, including linking up health and work services for everyone and changing the law where we need to. Consultation Overview. After we published the Green Paper, we wanted to hear people's views to help us with our plans. We heard from lots of different people, including working-age people, young people, older people, those in the armed forces, and veterans. We also heard from employers, local authorities, and healthcare professionals. Altogether, we had around 6,000 responses. People told us that they agree things should change, and life should be made better for disabled people and people with health conditions. Most people agreed with 4 things. We should make changes to the work capability assessment. Employers have a big role in helping people get into and stay in work. There should be more access to occupational health services. We should share research and evidence on the ideas which work best. We know that transport, housing, and debt are also issues for some disabled people and people with health conditions, and that these issues often make it difficult for them to work as well. We know that to make the biggest change, we need to work jointly between the Department for Work and Pensions and the Department of Health, as well as across other departments and outside of government. 1 million more disabled people into work. We want to see 1 million more disabled people in work. In 2017, there were 3.5 million disabled people in work. We want that number to be 4.5 million by 2027. We will let everyone know how these figures change each year. Our strategy. As well as helping people into work, it is important to focus on helping disabled people and people with health conditions to stay in work. This is because we know that when someone has not been working for a long time, they are less likely to go back to work again. We want to improve and join up the welfare system, the workplace, and the healthcare system. We also want to help people, whatever their health conditions or disability, including people who have more than one condition, people who have less common or more complex conditions, people with conditions that change over time, and people with learning disabilities or autism. We know that mental health conditions and musculoskeletal conditions are the most common conditions that affect people's ability to work. So making sure services work for these people is an important focus of our plan. Changing the attitudes of people is also important in making life better for disabled people and people with health conditions. We also want to look at how technology can help employers to support people and help employees to do their jobs more easily or better. Delivering a program of change. We have already made progress on many things in the Green Paper. But there is more we still want to do. We need to continue learning and working with disabled people, people with health conditions, experts, research partners, and academics. We need to test our ideas to check they do what we want them to do, and in the best way they can, before we decide to roll out the best ideas. In 2018, we will set out our full approach to building and sharing evidence over the 10-year period. Our research and trial activity will be supported by the Innovation Fund. We will also shortly start a contest to find and fund worthwhile ideas. This will be the Challenge Fund. A working age policy research unit is also going to be set up to help develop the evidence base. There are 3 key questions we want to explore over the next 2 to 3 years, and we aim to set our proposals later in the Parliament. These are: how to personalise and tailor employment support in the welfare system, with improved assessments for financial support. How to get the right incentives to be in place for employers, so they help people get into work and stay in work. How to make the occupational health offer work for everyone who is in work. We will also be working jointly with charities, local partners, and employers. We will tell you about the results of our work, and each year we will publish the numbers of disabled people in work. The final part of our work will be to implement changes that we find work best. We will start this in the early 2020s.